So important to mental health really is the brain. And so we're going to talk about the neurobiological foundations as it relates to psychiatric nursing. Our objectives are about applying knowledge about the structure and function of the brain to that physiological response that individuals may have to stress, looking at the impact of that response as it impacts mood and capabilities, review genetics, and also look at and assess clients that from a biological perspective. A brief overview important to understand is that stress really is a common human experience. Stressors can be internal and it can be external. So, um, examples of stressors can be an event or situational condition that results in an individual having a psychological or experience physical stress. Internal is things that can happen within that individual, their response. External are things that can happen from the outside. And that stress response is our own unique response to what is going on within us. It's a survival response that helps us to, as individuals, to really respond quickly to a situation that we may view as a threat. When it's an acute response, it usually results in a physiological change. It can cause our heart rate to increase, our muscles to tense, and even cause our breathing to change. When a person experiences acute stress, the individual returns to the state of equilibrium following that event. However, there are often times when an event can be repeated or it can be excessive. And if that happens, there's a risk that happens due to the hormonal changes, but also the repeated stress experience can cause an overreaction within us. And so we just want to keep this as an open part of our discussion as we continue not to only talk about stress, but when we start to talk about the psychological impact that this may have on our clients. Important points to keep in mind are that thoughts, emotions, and behaviors originate within our nervous system. And so the brain approximately weighs about 3 to 5 pounds and has billions of neurons. And the brain is really one of the most complex and essential organs. Keep in mind that the brain, when you look at those fissures or those lines that you see in every picture of the brain, going back to the one that starts off this presentation, the brain folds within itself. So if we actually lay that out, it holds and is allowed to hold much more information. If I think about it, I think like of an accordion, and that when you look at accordion, it looks small until that individual begins to spread it out, and that's exactly what happens with the brain. And in that process, what happens within the brain are these firings that happen between these neurons by the use of the neurotransmitters. And as we go on, we'll learn a lot about the impact that happens or the expectation that's supposed to happen when these neurotransmitters begin to help our brains communicate across the brain, but also to look at what happens when it doesn't happen as intended. So again, brain is composed up of billions of neurons that conduct these electrical pulses um, released within and from those neurotransmitters. And these neurotransmitters are a chemical substance that open and close ion channels, function as a neural messenger. It turns on and off those signals. And the neurons and connections help the function of the brain. It helps with the regulation of our blood pressure. It also helps us regulate that sense of self. Within the cerebrum, this is one of the largest parts of the brain, and it does have two hemispheres. And that hemisphere can be dominant um, depending on the individual, which means you can have someone who's dominant in the left hemisphere, which is most individuals, and then you have a much smaller percentage of individuals who operate out of the right hemisphere based on what's dominant. And there's some research that says that your individual who operates from the left hemisphere, and that's their dominant, will usually write with their right hand, and those who are right dominant will write with their left hand. Either way, based on that information, it is perceived that those with left hemisphere dominancy um, are have a focus between that left hemisphere being that control of not only the right side of their body, but also their language and speak, their comprehension and logic and reasoning. And so you'll see individuals that being, I'm not going to say that they're proficient because I don't want to go there. I just want to say that those are some of their stronger attributes. And as your right dominant, that individual has a greater creativity and imagination, their affect, their behavior, their spatial awareness and perception. All those things operate from there. Now, I say the individual that is at the greatest is that individual who can write with both left and right. And they have a little bit of all of that going on. So the question is while you're listening to this, what side of the brain are you dominant in? The cerebrum connects again, those are connected. The cerebrum hemispheres are connected with that corpus callosum, and within that, you'll find your white matter. It grows in size between the ages of 21 and 24. It helps coordinate the activity that exists amongst humans and also is important to problem solving. Within the cerebral cortex, you'll find your gray matter. That's where most of behaviors that make us who we are, our personalities, that's where that derives. It has a connection to sensation, speech, thinking, voluntary motor functions, and also perception. Now, within each hemisphere, there are four lobes. You have your frontal lobe, which is your largest, your parietal, which is where all that processing happens. Your temporal lobe is where our emotions come from. That's really, I think, housed within that is that limbic area. And then you have your occipital lobe, which helps with perception and recognition. Now, within the frontal lobe, many refer to that as your chief administrator of the brain. Again, we can have planning and problem solving, memory, we can have concentration, purposeful behavior, speech organization, and emotional responses. It's also the place where we actually make sense of whatever language it is that we speak. Now, when there's damage to that front lobe, it will make sense that the impact then would be to the areas that that area focuses on. So emotions like fear, aggressiveness, rage, and euphoria. Individuals can have distractibility, poor attention span, apathy, lack of feeling, emotional blunting, and an inability to really try to plan ahead. And if you start to realize that some of this might revolve around you as far as your personality as we go on, and as you learn more about mental health, you'll realize some of the causes that are related to sometimes our lobes not, or that frontal lobe not functioning at its optimal. Within the temporal lobe is where the Wernicke area is. That's where speech, our ability to have that speech is held, whether it be written, verbal, or our ability to visually recognize. Our emotions are held in this area as well. Impulses and aggression control, that is held here, along with aspects of and as it relates to sexual action and meaning. When there's a damage to that temporal lobe, there's going to be some disorder in learning and memory. There can be some aphasia or an impact in how language is being interpreted, an inability to learn new information because that's where our memory is kept. But there also can be some emotional disturbances because it affects this area. So individuals, again, if we go back to those feelings, anger and rage are there, fear and anxiety. Individuals can have panic attacks as well. With your parietal lobe, that's where the processing of information happens. It's where perceptions and interpretations of information that our brain takes in happens. Spatial awareness, along with body awareness, happens in this space. Noise is able to be filtered out to better have clarity of the situation. In this space is also where individuals um, have some, I'll say, executive functionings that include dressing themselves, reading a map, or following directions. But again, that processing place for understanding language, and that creeps into that left hemisphere. With a parietal lobe damage, individuals can have the opposite sometimes. And I want to make sure we say this as we put this on a spectrum, that damage to any sections of these lobes can either cause the brain to underperform or overperform. So individuals can have loss of sensation or increased sensation, not being able to, or an inability to identify objects or to understand language that may be spoken by others. And they may be able to talk, but they may not be able to fully understand. Occipital lobe helps perception and recognition. It's visual information that we take into our brains through our eyes. So whether it be depth perception, color recognition, being able to look at names and objects and be able to recognize them, tracking movements, but also trauma and hypoxia um, to this occipital lobe can cause blindness and can result in visual hallucinations. With the basal ganglia, this is right underneath the frontal cortex, and this is where you'll see a lot of the connections that will happen between the cortex and the midsection of the brain. So, learning, programming, automatic behaviors, and those pieces of cognition that are very fundamental to the work that it is that we do. However, damage to this space happens when we see outpatients who have Parkinson's, or which impacts their dopamine level, your Huntington's, which is impacted by the GABA, and then you see the choline levels. And then when you look at your patient, that's where you'll be able to connect sometimes the illogical or loose associations that may be had, especially in our patients who may have a diagnosis of schizophrenia. Within the limbic system, this is held within the amygdala. This is your emotions. This is helps modulates anger and aggression. When you think about the nervous system response to fight or flight, this determines that. It puts emotions to those responses that we have. Sexual arousal and aggression can happen here. And research looks at the limbic system as the biological etiology of bipolar disorder. And you'll learn a little bit more about that when that section comes up. Within the limbic system, there is a computer that helps relay all of the information that we have, filter out information so that there's not an overload. When it looks at incoming information, it relates it to emotions, moods, or memories, and regulates our awareness to them. When it's not functioning or when it's dysfunctioning, then it's difficult for an individual to integrate proper emotions into what their sensory is picking up. They can have hyper or hyposensitivity to pain, and also an inability to be able to differentiate if something feels good to them or if it doesn't. And so, adding to that would be their difficulty to be able to be present in the moment. The other part of the limbic system, the hypothalamus, is about our survival, right? How we function. It's the regulation of our intake and output as it relates to food and fluids, our body temperatures, our sexual functions. Um, the control center, though, is that pituitary along with the autonomic nervous system. Um, and it relies on the connections throughout the brain in order to maintain this. Dysfunction can happen that can result in appetite and sleep problems, seasonal affective disorder, temperature regulation problems, especially in your patients with schizophrenia, eating disorders, emotional expressions. Think about all of these things: sleep cycles, disorder of sexual functions. And if you really have a hard time with mental health, or you're saying to yourself, okay, this is not me, I want to come back with a disclaimer. Mental health does not require medical assistance. I feel as though mental health says that you're doing okay. A deviation from mental health has something to do with our brain, and it can be something temporary, it can be something permanent, it can be long term, it can be acute, it can be chronic. So, in order to understand mental illness, you really have to understand what's happening in the brain. And I think that when you can associate what's happening in the brain, especially from anatomy and physiology standpoint, it makes it easier for you to be able to understand and receive your patients. Now, the hippocampus within this limbic system uh, directly connects the hypothalamus and the amygdala and allows for us to come back and recall back memories that we may have, to respond to them with emotions like laughter and tears. We can transfer information from our short term to our long term. However, if an individual has a dysfunction that creates psychosis, it really is in psychosis hard for an individual to not only store that information but to retrieve it. There is going to be some deficits within their verbal memory. Recall of that short-term information is going to be difficult. And when a patient or a client experiences an event that is traumatic to them, they will see it more, not so much. Um, it's, I guess it would be just perception. It's more visual for them and feelings than it would be language that they can go back and remember. And along with that becomes those dissociative symptoms. And I think that that disassociation that happens with the psychosis is the reason for why recalling events or things that happen during that time make it difficult for the for recall. Circadian rhythm is important, and for the most part, just understand that sometimes um, when there's an imbalance as it relates to mental health, it can either impact an individual's sleep, or sleep can cause that imbalance. And so what happens is our body really works on a 24-hour cycle, and it really thrives on the cycle of light, darkness, and temperature that happens. With this, what impacts us when it relates to circadian rhythm are our body's fluids and tissues, our mental abilities and mood, and it can change that from and have a wide variation, depending on not only the time of day, but actually the moment in time of that day. Sunlight usually is a cue from an external space that tells us, okay, it's time to get moving. So when the eye gets a hold of that light, it starts engaging um, the brain in order to respond to that light signal that it's receiving. And it creates, again, that timing, that space, or that pacemaker of that circadian rhythm. During this process, there are electrical and chemical messages that are being sent to the brain and the brainstem by way of the pituitary and the pineal gland. And within that space, there are messages also being sent to the heart hormonally, to the adrenal glands, the liver, the kidneys, and the intestine. Generally, we all need about 6 to 9 hours of sleep, um, and during that time is how our body starts to get into that rhythm. Again, with that change of light to dark, but also with temperature changes. And if you ever notice, I've noticed that if I'm up late at night, I can tell the time based on the temperature change in the evening. Much more during the day, I need less, but as the evening comes, I chill. And so that's when I realize, oh, it must be this time in the morning. So there is some implication to our body's response um, in this piece of the circadian rhythm as it relates to light, darkness, and also temperature changes. There are stages to our sleep. The first part of that is falling asleep. Then there's sleep itself. 50% of individuals usually get to that. Within your third and fourth stages, your individual goes into from a deep sleep to a delta sleep. And it's the first half, or represents the first half of the sleep period. The final stage, which is the stage that we would all love to be in, which is that REM phase where we have rapid eye movement. It takes up about 20 to 25% of our sleep time, and that's where we have these vivid dreams. And during those dream periods, you can have you see within a client who is sleeping those eye bursts of rapid movement. Stages 2 through 5 are repeated several times throughout the night. Deep sleep comes a little bit much, comes briefer, and your REM sleep is what is your longest. It is optimal for individuals to be able to go through all of those stages of sleep every time they go to sleep. Not that it's going to happen, and we'll talk later about why it doesn't. Genetic does play a role when it comes to mental illness because research and investigations have shown a connection between individual family members and genetic factors to many of the mental illnesses that are going to later be discussed. It involves not only some major genes, but also some mechanisms that can impact gene expression, especially when under extreme stress. Manifestations of mental illness can result when there's an alteration in neuron functioning or destruction of those neurons, or in an alteration in the ability of those neurons to communicate or make that connection between one another. Now, there is a physiological and psychological response to stress, which we talked about earlier. Take, for instance, here we go. The response to stress can be biological and it can be physiological. Now, when we think about biological, it is something that like it's a response that we have. Sometimes it's a part of, most of the time, it's a part of our survival or our coping mechanism. With biological and physiological responses, it's happening regardless of what it is that we experience. And the effects of or the response that we can have not only takes into consideration what we talked about earlier, musculoskeletal, but also respiratory, cardiovascular, GI, and the nervous system. Now, if you have resilience, it can result in an individual having a really adaptive response, being able to adjust to the situation because they're able to adapt when difficult or challenging experiences happen, whether it be because they've been through it before or examine someone who's been through it before. The opposite side of that is that response can be maladaptive. And so, whether it be because that individual has never had it or due to internal or external factors, they're not able to quickly adapt. Now, with chronic stress, it can be a problem down the line if it's something that we receive repeatedly. And in most cases, chronic stress can develop into serious physical, emotional, and psychological effects to our well-being. Now, I want to keep in mind that although we talk about biological and physiological stress, there's another stress, and that is perceived. So if you look at this picture here, this individual's response to stress, biologically, physiologically, fight or flight, is to begin to run. What's different in perceived stress is what you will see in the following. Now, when it comes to perceived stress is up to an individual. So in the previous, that individual was responding to being chased by a bear. But in perceived stress, was it really as serious? Regardless of how small or how big the problem is, a person's perceived stress ends up with the same result as an actual. So I just want to make sure that you keep in mind that even though we may laugh at the picture, to individuals, this bear is a lot bigger than he is. So, pathophysiology, what's happening? There's a threat to homeostasis, right? So the body's going to respond. It's going to send out a call to the amygdala, to the hypothalamus. There's a discussion that's going to happen between them, and they're going to send out neurotransmitters and hormones. Okay? So again, when a person undergoes a stressful event, the amygdala operates as a command center. It processes the information, and then it sends a distress call to the hypothalamus. And within that, the body responds physiologically and psychologically. Now, the stress response, again, results in that release of neurotransmitters and hormones. This is a unique, I would say, transportation system that's held within our brain that allows for a quick response. Our neurotransmitters that we're talking about in this instant, as I mentioned before, can be your acetylcholines, your norepinephrines, and your epinephrines. It can also include hormones like cortisol and epinephrine and adrenaline. Now, when a stressful situation is experienced, we talked about how the amygdala acts as that command system center and then sends that information to the hypothalamus. Then the hypothalamus releases that corticotropin hormone, and that travels to the pituitary gland. And within the pituitary gland, that causes a release of your acetylcholine. And as a result, this I'll say hypothalamic pituitary adrenal axis, along with your autonomic nervous system, begins to act in a way and communicate to this stressful response, and causes an impact throughout the whole body. Each response that we have, we call that a fight or flight. So each response represents that attempt by an individual to either avoid stress or danger, and to gain some sense of control, equilibrium. Now, this equilibrium is achieved when the threat is perceived to be gone. The hypothalamus tells all those body systems to go back to normal. Now, if the central nervous system doesn't return to normal or the stress doesn't go away, then the stress response will continue. Now, remember what we said earlier. Prolonged activation of the stress response system can only happen so long before it begins to have a detrimental effect on the body. So, what are some of those physiological effects? So, we're going to bring back our guy who has experienced a physiological response. So, when we look at it, we can see the heart begins to beat, it increases, blood pumping, therefore the blood pressure is going to go up. However, at this time, when the blood flow begins to increase, it actually goes to the muscles. The endocrine system gets involved, releasing cortisol, adrenaline, and noradrenaline. And this results in the blood vessels constricting. Again, that's where you're also going to see where the blood pressure is going to go up. There's going to be fewer growth hormones that are going to be involved, and other unnecessary hormones that's going to be decreased in order for the body to focus on the release of the cortisol, adrenaline, and noradrenaline. Within the lungs, oxygen is going to need to be consumed again because now the heart is gone up, so the demand has increased. But also, breathing and respirations have gone up, so oxygen is going to be needed. The person is going to be taking more in. That means that carbon dioxide needs to be expelled. So that's why the respiration is going to go up and the breathing is going to be faster, but it's also going to be shallow. So you got to be careful with your patient and your client, because if they're experiencing this and they don't have a proper blowing off of that CO2, your patient can pass out. Within the skin, you're going to see that sweating is going to increase. Blood flow comes to the skin. Blood flow that normally comes to the skin becomes reduced, and so your patient is going to look a little bit paler. And within the pancreas, there's going to be a release of glucagon. The body's going to need that for energy, and as a result, there's going to be less insulin, and your patient's blood glucose level is going to rise. So again, shaky, sweaty, adding to that. When you think about fight or flight, think about several things that is happening. In the fight response, they can have anger, aggression, stomping, kicking, punching. They can have issues as it relates to GI and the stomach, nausea, vomiting, knots. In the flight, the anxiety and that feeling of being trapped, they get tense. They can have some fidgeting. Within the freeze, if it is causing dread, heart pounding or numbness, pallor, or it can even cause them to hold their breath. And again, you have to think about safety issues. Fawn is something new to me, but discussed within this course. I mean, that is when you're going to see self-directed anger. There's going to be no boundaries, feeling no identity. They may try to, I'm not going to say negotiate, but they may feel as though they have to please the person who's aggressing them and ignoring what their own desires are. And in faint, there can be changes in vision. They can feel lightheaded. They can black out and even fall. There is a immune response that happens. The body's response to destroy antigens, including inflammation or microbes, including your leukocytes. Now, there can be increased cytokines. This is a protein that mediates the immune response and can increase inflammation in lymphocytes. The increased cortisol is a hormone responsible for glucocorticoid activity and can cause that increase in blood sugar levels that we talked about earlier. And during that immune response, the cortisol is really the primary stress hormone that again results in us having that increased glucose. Our blood pressure is going to be up, but also that release of inflammatory substances. As it relates to your corticosteroids, this hormone or cortisol is something that's produced by our adrenal cortex and involved in the electrolyte balance and sodium retention. And this is significant in our immune system. Now, the impact that stress can have on our immune system, when the body is really under stress and you have these cytokines that are being released, then and your immunity is activated. However, these cytokines, they stimulate the release of corticosteroids, including cortisol, which can inhibit the immune system and its ability to respond. And therefore, you're going to have increased inflammation and an inhibited immune response. You can also have damage, especially even more so if an individual has chronic exposure to stress. So keep this in mind, that the information that we're receiving right now, even as I'm going through this and putting it all together, think about what I said before, that an imbalance in mental health can be acute, chronic, short-term, long-term. If the immune response increases cytokines, increases cortisol, and corticosteroids, and impacts our immune system, causing inflammation, causing our blood sugars to rise, can cause damage, then think about not just from a mental health standpoint, but think from a physiological standpoint if you see yourself working with your patients on a med surg unit. Stress on their body from just being ill causes more damage underneath than we know. So our job is about trying to decrease that stress. That's why you'll see in your patients where sometimes they don't come in with diabetes, but they have an elevated blood sugar. And so not necessarily do we give them a diagnosis of, or do that patient receive a diagnosis of diabetes, but they're asked to be monitored later, because usually when the stress is alleviated, or the problem, or the what's the cause of the stress is eliminated, then a patient will turn back to normal. But you have to keep these things in mind when caring for your patients.